Hemodialysis Anderson CCHT practice exam case. A reused dialyzer would be rejected if visual inspection reveals a few clotted fibers. Which of the following may be caused of postrenal acute renal failure, ARF? Obstruction in the ureter or the urethra. President, blank, signed a bill that allowed Medicare coverage to pay for treatment for all patients with chronic kidney disease. President Nixon. What infection control precautions should be instituted for HIV-infected patient on a dialysis unit? Standard precautions. An electrolyte is a substance that dissolves in water to form electrical current. What was the primary anticoagulant used in the first eriphycal kidney? Hiridin. Which of the following chemicals may cause methemoglobinemia, in which red cell hemoglobin cannot transport oxygen? 1-nitrates 2-chloramines. CKD patients are at risk for developing peripheral neuropathy, which may manifest as 1. Burning feet. 2. Restless legs. What principle is used to decrease complications relate to fluid removal? Ultrafiltration profiling. Which of the following statements regarding hand washing is accurate? 1. Hand washing should be done before and after glove removal. 2. Hands should be washed before and after entering patient areas. 3. Hands should be washed between patient contacts, and after touching an environmental surface without having gloved first. Polyamide membranes, used for reverse osmosis. 1. Have a wide pH tolerance. 2. Are very susceptible to degradation by free chlorine. Common skin changes related to CKD stage 5 include brittle nails and ecchymosis. Dialysing a patient at a high blood flow rate with a small gauge needle may result in hemolysis of RBCs. Long-term exposure to cellulosic membranes used during dialysis has been associated with 1. Infection. 2. Malignancy. In order to remove smaller solutes, such as endotoxins, which filter should be utilized? Ultrafilter. How can air enter the dialysis bloodlines? 1. At connections that are not absolutely tight. 2. By osmosis through contact with blood tubing. The National Kidney Foundation, NKF, recommends that all individuals be assessed for increased risk for developing chronic kidney disease, CKD, utilizing which lab value? Creatinine level. Which of the following statements about bicarbonate dialysate is accurate? The bicarbonate concentrate is very stable and has a long shelf life. In 1989, FDA approval of blank diminished the need for blood transfusions in chronic renal disease patients. Epoetin alpha, epigen. High-efficiency dialysis requires highly permeable cellulosic membrane with surface area of 1.5 m or more. The patient with low post-dialysis weight is at risk for 1. Hypovolemia. 2. Clotting of the vascular access. Which of these patients' populations has the highest proportion of body water? Infants. What are the effects of overmixing the bicarbonate concentrate? The patient can experience an increase in sodium levels. What is the target blood pressure, BP, recommended by the Joint National Committee on Prevention, Detection, Evaluation and Treatment of High Blood Pressure in Patients with CKD? Less than 130/80. A staff member who is immune to hepatitis B due to the vaccination series will have which of the following lab results? 1. Anti-HBC negative. 2. Anti-HBS positive. Many dialysis units require 2 people to verify and document that, blank, before using a reprocessed dialyzer. 1. The dialyzer is correct for a specific patient. 2. The disinfectant test is negative. Which of the following contaminants in water may result in the hemolysis of RBCs? Nitrate. Which statement regarding the removal of chlorine from water utilizing 2 carbon tanks is accurate? If sampling reveals there is chlorine in the water leaving the first tank, then water must be sampled after leaving the second tank. CDC recommendations for hepatitis C positive dialysis patients include: all patients should be monitored monthly for liver enzyme elevations. Advantages of reverse osmosis water treatment include: rejection of bacteria, viruses, and pyrogenic materials if the membrane is intact, when compared with high-efficiency dialysis, high-flux dialysis. Demonstrates much higher water permeability. What action should be taken if a blood leak detector alarm is activated and no blood can be confirmed on visual inspection of the site? Check the dialysate with a hemostix. What are the responsibilities and requirements of a medical director of a dialysis facility? Being knowledgeable of and responsible for integrity of the water treatment system in the facility. A staff member who tests positive for IgM antibody to hepatitis B core antigen, IgM anti-HBC. Has had a recent infection with hepatitis B virus. Which of the following statements regarding the removal of toxins in dialysis is accurate? The greater the dialysate flow rate, the greater the removal of solutes. Which of these factors contribute to the patient not being optimally dialyzed? Clotting of the dialyzer. Which of the following statements about consent for treatment is accurate? A. A written consent for dialysis. Consent for placement of an access catheter. B. A renal patient who has been admitted to the hospital with sepsis has given implied consent upon signing the initial admission paperwork. C.2 Consents are needed for dialysis, 1 for the dialysis itself and 1 for access procedures or modifications. D. In an emergency, such as an aspirin overdose, it is not necessary to have consent prior to beginning hemodialysis. C.2 Consents are needed for dialysis, 1 for the dialysis itself and 1 for access procedures or modifications. Heparin administered intravenously reaches peak anticoagulant activity in 5 to 10 minutes, and has a half-life of 90 minutes. Who was the first person to use the term dialysis? A. Bernard Turner. B. Leonard Rountree. C. Thomas Graham. D. John Abel. C. Thomas Graham. All 50 states require the same certification exam for employees fulfilling the role of dialysis technician. True or false? False. What is the preferred vascular access in patients undergoing chronic hemodialysis? Radial, cephalic arteriovenous fistula. Air embolism is a serious event that requires immediate action. What is the proper first response to this event? Clamp the bloodlines and stop dialysis. During a dialysis session, it is important for the dialysis technician to monitor dialysate temperature since fluid temperature, blank, will result in hemolysis of red blood cells, RBCs. Greater than 41 C. Severe recirculaton, black blood syndrome, due to stenosis of the fistula, has which of the following signs/symptoms? 1. pH below 7.002, very dark blood. The maximum level of endotoxins in water used to prepare dialysate and reprocess dialyzers must not exceed 2 endotoxin units per milliliter, EU/ml. Deionizers produce water of high ionic purity. If the venous pressure reading suddenly decreases dramatically, the dialysis technician should assess 1. The transducer to see if it is wet. 2. The arterial chamber to see if it is clotted. Glomerular filtration is dependent on sufficient blood circulation to the glomerulus and maintenance of normal filtration pressure. A dialysate solution containing too much sodium may result in fluid leaving the cells, causing blood cells to shrivel. Urea contributes to symptoms of uremia, but is not the primary toxin of this condition. True or false? True. Which of the following are advantages of an arteriovenous graft over a fistula? 1. A graft can be accessed shortly after placement, 2 weeks. 2. A graft is easier to cannulate. What procedures should take place prior to the first hemodialysis treatment? Begin a detailed discussion of the advantages and disadvantages of dialysis. Ultraviolet light is used in treating water in order to destroy microorganisms. If a patient who is just starting dialysis run complains of a bitter, peppery taste in his mouth and numbness around his mouth and lips, the nurse should stop dialysis treatment and remove at least 10 milliliters of blood from each needle. A patient is considered to be in end-stage renal disease when he or she requires maintenance dialysis for survival. What is a molecule? The smallest unit of a substance that retains its chemical properties. A patient with an AV fistula on the right arm and a history of left-sided mastectomy should have her blood pressure checked on the left arm, since the risk of lymphedema is low. Which of the following credentialing certification program offer the dialysis technician the most cognitive content related to water treatment principles? A. Certified Clinical Nephrology Technologist. B. Certified Hemodialysis Technician/Technologist. C. Certified Biomedical Nephrology Technologist. D. Certified Clinical Hemodialysis Technician. Certified Biomedical Nephrology Technologist. Which protective gear should be used when working with chemical disinfectants? 1. Gloves. 2. Eye shields. 4. Waterproof gown. Which lab test is utilized to detect and quantify bacterial endotoxins? Limulus amoebocyte lysate, LOL. During ultrafiltration, what happens when positive pressure is applied to the blood side of the dialyzer? Plasma fluid will be pushed out. What are the steps in order to remove air from a dialyzer? 1. Prime normal saline into the dialyzer from the bottom. 2. Run the bloodlines to the dialyzer, turn the dialyzer so the venous end is up. 3. Run saline in through the arterial bloodline, trough the dialyzer venous bloodline and into a basin. 4. As the dialyzer fills, tap it lightly, turning it from side to side to ensure all air is removed from header. Prior to the beginning dialysis, the physician order must include, pick 3 numbers, 1. Specific dialyzer. 2. Blood flow rate. 3. Duration of the dialysis. 4. 3 units of packed red blood cells. 1, 2, and 3. The most common impurity in tap water is calcium carbonate. What is a clinical manifestation of renal cell carcinoma? Hematuria. What potential patient complication should be monitored by dialysis personnel if reverse filtration occurs and dialysis water is moved into the blood? Pyrogenic reactions. With osmosis, water flows from areas of low concentration of solutes to areas of high concentration of solutes. What is the most common complication of AV fistula? Thrombosis. If a young pediatric patient experiences hypertension during dialysis, which of the following corrections might help? Use a smaller surface area dialyzer. What is the recommended treatment for osteodystrophy in CKD patients? A diet high in protein. Blood urea levels may be increased as a result of gastrointestinal tract bleeding and steroid use. Dialysis technicians should have knowledge of PIC 2, 1. Equipment setup and maintenance 2. Principles of computer technology 3. How to administer intravenous medication if an emergency arises 4. Patient education related to dialysis and financial obligations. 1 and 4. To safely dialyse a patient who is hepatitis B positive, the dialysis technician should ensure that the is placed in an isolation room and has a dedicated machine. The dialysis technician assists with nursing management of constipation in CKD patients by encouraging a diet high in fiber. The dialysis technician caring for Mr. Jones during dialysis treatment notices that the negative arterial pressure has suddenly increased to -190 mmHg from a previous reading of -100 mmHg. What might this indicate? 1. A dislodged needle 2. A kink in the arterial line. Following exposure to blood via needle stick, the first action by the dialysis technician should be to wash the area with soap and water. Patients who are infected with methicillin-resistant Staphylococcus aureus, MRSA, or vancomycin-resistant enterococci, VRE, can safely be cared for in the dialysis unit by 1. Standard precautions, making sure to wear gloves if touching soiled skin or clothing 2. Making sure all surfaces, of machines, patient chairs and equipment, have been cleaned with a 110 to 1000 bleach solution following every treatment. What are some negative aspects of synthetic membranes? 1. They are expensive 2. They require automated ultrafiltration control 3. They can absorb proteins on the membrane surface. Increasing sodium in the dialysate may help prevent hypotension, cramping and disequilibrium syndrome. The major adverse reaction the dialysis technician should be assessing the dialysis patient for following heparin administered is bleeding. Patients sensitive to ethylene oxide sterilization techniques may benefit from blank because it does not use chemicals or radioactive materials. Electron beam sterilization. Most patients who have been on dialysis for over blank will have dialysis amyloidosis, DA. 3 years. Dr. Willem Kolff created the first dialyzer suitable for human use, rotating drum dialyzer, in 1943. What material is used to construct the hollow tubes on this device? Cellophane. What are advantages of hollow fiber dialyzers compared to parallel plate dialyzers? 1. The ultrafiltration is precisely controlled 2. They can be reused. The vas recta capillaries surround the loop of renal and nephrons and play a major role in concentration of urine as it moves through the tubules. When initiating and terminating dialysis, what personal protective equipment, PPE, should dialysis healthcare personnel use? 1. Gloves 2. Face shields 3. Gown. Signs/symptoms of anemia in CKD patients include dyspnea and fatigue. Kidney failure causes retention of hydrogen ions resulting in metabolic acidosis. Hepatitis B. 1. Highly transmissible 2. Can survive for several days on environmental surfaces at room temperature. Disequilibrium syndrome in a dialysis patient requires administration of hypertonic saline or mannitol. The primary reasons to institute protein restriction before initiation of dialysis are to 1. Minimize nitrogenous wastes. 2. Aid in the control of uremic symptoms. Which of the following signs/symptoms would be noted in a dialysis patient who has developed hemolysis? 1. Complaints of abdominal pain or cramping. 2. Cardiac arrhythmias such as bradycardia. The first arteriovenous (AV) shunt for chronic renal patients was placed externally, using Teflon tubes. Before initiating or terminating dialysis via femoral catheter placement, the dialysis technician should wrap the caps and ports in 4x4 dressing soaked in hospital-approved disinfectant. To achieve an optimal concentration gradient, what direction should blood and dialysate flow? In opposite directions. When preparing a dialyzer for patient use, the dialysis technician must ensure all air has been removed from the dialyzer. Dialysis technicians working with patient undergoing high-flux dialysis should be alert to the development of bacterial infection related to breaks in the blood tubing due to high-volume pressure. Some causes of anemia in CKD patients include 1. Decreased production of erythropoietin, loss of blood through the GI tract. What is the amount of saline required to prime the dialyzer? 500 ml. What is the major plasma buffer in the body? Bicarbonate.